Hi everybody, I'm Kelly McNicholas Kury, one of your Pitkin County Commissioners. And in our ongoing efforts to talk to you and everyone in the community about our roadmap to reopening and what the recovery from COVID-19 will look like, I want to talk to you today about what contact tracing is and how it is essential to our strategy to getting back to a more normal life, while also preventing the spread of COVID-19 and a second wave of infection that would be devastating. Contact tracing is a tried and true method for preventing the spread of contagious diseases like COVID-19. It requires the awareness and the participation of the entire community because it identifies who may have been unknowingly exposed to a patient confirmed to have COVID-19, and that person could be you. Contact tracers are part of our public health team. They will work with infected patients to support those patients to enter into isolation and support them throughout the duration of their isolation on needs such as accessing medical care, food delivery, and mental health support services. Our contact tracers will also interview the infected patients to identify who they may have had contact with during the time when they were infectious. The CDC defines a contact as someone who is within 6 feet for a period longer than 15 minutes in the 48 hours before their symptoms developed until the infected patient went into isolation. After conducting the interview with the infected patient, our contact tracers will get in touch with all those contacts to advise them that they may have been exposed to COVID-19 and to instruct them to quarantine for 14 days. Our contact tracers will help contacts enter into quarantine and provide them support throughout the quarantine period, including calling daily to confirm that contacts are checking their symptoms regularly and maintaining physical distance from others in the household. Now, in some situations where there are dense households or family members who are vulnerable or immune compromised, the tracers will also help to move contacts to alternate locations to do their quarantine. If you are advised to quarantine, you will not be told who may have exposed you. And while I know this is frustrating, it does protect the patient's privacy. Our contact tracers are highly skilled and trained to maintain patients' confidentiality, conduct successful interviews, clearly explain the disease and the expectations of quarantine and isolation, connect patients with medical and social supports, demonstrate compassion and empathy when delivering this difficult news and information, and apply cultural sensitivity to reach all members of our community. As we open up, we expect that there will be more cases of COVID-19. And as you engage in more activities, you will be going more places, spending more time with people, and doing more things. If you become exposed and identified by our contact tracing staff, you will receive a call from them telling you to quarantine and to monitor your symptoms. They will counsel you in everything you need to know about the virus, how to successfully prevent spreading it to your loved ones and others, and they will frequently talk with you to support you during the quarantine period. I hope this has helped to explain the process of contact tracing to you and why it is such an important element of our roadmap to reopening. Your support in this is appreciated. I hope you and your family are staying safe and healthy, and I know we will all be together again soon, and I look forward to that time.